Hello and welcome to OncLive News Network. This is Inside Oncology. I'm Laura Jones.
And I'm Tara Petersen.
Coming up, we're going to hear about the most important studies from the ESMO annual meeting in Madrid. In addition, we'll be talking to Dr. Mari Markman about the latest in ovarian and cervical cancer research. Later, we'll hear from researchers at the Herbert Irving Comprehensive Cancer Center associated with Columbia University. In news from the ESMO annual meeting, the top story was the unprecedented findings from the Cleopatra Trial in breast cancer. Dr. Sandra Swain reported the final overall survival analysis of the Phase 3 trial, which evaluated addition of pertuzumab to trastuzumab and docetaxel, showing that the combination improved survival by almost 16 months compared with trastuzumab plus docetaxel alone in women with HER2-positive metastatic breast cancer. The triplet demonstrated a median overall survival of 56.5 months compared with 40.8 months with trastuzumab and docetaxel. Even more impressive is the fact that the trial allowed patients in the placebo arm to cross over to pertuzumab. Therefore, the true benefit with pertuzumab may be even larger than was observed.
In other breast cancer news from ESMO, 2 studies have shown promising findings for maintenance bevacizumab as a treatment for patients with HER2-negative metastatic breast cancer. In the Phase 3 IMELDA study, maintenance bevacizumab in combination with capecitabine improved progression-free survival by 62% and overall survival by 57% when compared with bevacizumab alone. However, the study had no chemotherapy arm. Additionally, the Phase 3 TANYA trial showed an approximate 25% improvement in progression-free survival for patients treated beyond progression on first-line bevacizumab using bevacizumab plus chemotherapy. Survival data is expected in 2015.
On the immunotherapy front, PD-L1 inhibition continues to show impressive results in advanced melanoma. Results from a Phase 3 study demonstrated that nivolumab improved objective response rate over investigators' choice of chemotherapy from 11% to 32% in patients who had already received ipilimumab and were BRAF inhibitor if they were BRAF positive. The median time to response favored nivolumab at 2.1 months compared with 3.5 months in the chemotherapy arm. The treatment responses were also longer lasting in the nivolumab arm, with 95% ongoing at the time of the analysis.
In fact, the lead investigator, Dr. Jeffrey Weber, said he hopes this study puts an end to second and third line use of chemotherapy. Nivolumab has now achieved priority review from the FDA for melanoma. The FDA decision date is set for March 2015. Another anti-PD-L1 monoclonal antibody, pembrolizumab, demonstrated an overall response rate of 21% in treated and untreated patients with non-small cell lung cancer. This was according to a Phase 1b study in 236 evaluable patients. In the untreated group, the overall response rate was 26%. High PD-L1 expression was associated with a 48% reduction in the risk for progression and a 41% reduction in mortality risk.
Another Phase 1b study of pembrolizumab showed promising activity in PD-L1 expressing advanced gastric cancer and was associated with a 31% overall response rate in heavily pretreated patients. 41% of patients experienced tumor shrinkage. Adverse events were consistent with those previously reported from pembrolizumab. A Phase 2 study exploring pembrolizumab in gastric cancer will begin in 2015.
Another BRAF and MEK inhibitor combination is showing promise in melanoma. Treatment with vemurafenib together with cobimetinib, which is an extremely selective allosteric inhibitor of MEK, extended progression-free survival and overall survival when compared with vemurafenib alone in BRAF-mutated patients with advanced melanoma. Vemurafenib plus cobimetinib was associated with a median progression-free survival of 9.9 months compared with 6.2 months with vemurafenib plus placebo. The overall response rate was 68% in the combination arm and 45% in the placebo arm. An interim analysis of overall survival showed a 35% reduction in the risk of death with the combination. Similar results were seen with the combination of dabrafenib and trametinib, which is FDA approved. A BRAF plus a MEK inhibitor will become a new standard of treatment for advanced BRAF mutant melanoma.
Next, a phase 1 study published in the New England Journal of Medicine and presented at ESMO has confirmed the benefits of crizotinib in patients with ROS1 rearranged non-small cell lung cancer. In the analysis, the overall response rate with crizotinib was 72% in ROS1 positive patients. Because ROS1 is present only in 1% of non-small cell lung cancers and conducting large trials would be difficult, crizotinib was already recommended by NCCN guidelines based on single patient case studies. The phase 1 findings could lead to an accelerated approval in this patient population. Also in lung cancer, results of the phase 3 IMPRESS trial show that patients whose EGFR-positive non-small cell lung cancer that had developed resistance to gefitinib experienced no improvement in progression-free survival from continued gefitinib plus platinum-based chemotherapy compared with chemotherapy alone. Median progression-free survival in 265 patients was 5.4 months in each group. The study answers a key question: should EGFR tyrosine kinase inhibitors be continued beyond progression? Lead investigator Dr. Tony Mock said, as the result demonstrated no difference in progression-free survival, the standard treatment should be chemotherapy in this setting.
In prostate cancer news, long-term follow-up of a phase 3 trial looking at abiraterone and prednisone demonstrated significantly improved survival compared with placebo, plus prednisone for men with previously untreated metastatic castration-resistant prostate cancer. After a median follow-up of more than 4 years and 1,088 patients, median survival with abiraterone was 34.7 months versus 30 months with placebo, translating to a 19% reduction in the risk of death with abiraterone alone. The survival results in this study are compelling, as 2/3 of men in the abiraterone arm and more than 3/4 in the placebo arm received subsequent therapy. 44% of men on placebo crossed over to abiraterone. Abiraterone was approved by the FDA for untreated metastatic castration-resistant prostate cancer in December of 2012, and the FDA just recently approved enzalutamide for the same indication. A challenge for oncologists will be to determine the optimal choice and sequence of available therapies. A 62-patient study published in the New England Journal and also presented at ESMO showed that prostate cancers that were positive for the androgen receptor isoform encoded by splice variant 7, ARV7, had lower PSA response rates to abiraterone and enzalutamide than those that were ARV7 negative. If these results are confirmed, a blood test could be used to predict abiraterone and enzalutamide resistance and help guide choice of therapy.
And in news from OncLive, the parent company MJH Associates has just announced the acquisition of Cure Media Group, which includes Cure Magazine, a vital resource for cancer patients and their caregivers. Cure is the largest consumer magazine in the United States focused entirely on cancer. Through the magazine's website, curetoday.com, patients can gain access to live meetings, a resource guide for the newly diagnosed, and other books and online tools. Thank you so much for watching OncLive News Network. We'll see you next time.